Arthroscopic hip surgery is used to treat a variety of orthopedic conditions. Majority of the arthroscopic hip surgery that I do is treating labral tears of the hip, and the labrum is just functions to act like a bumper to the hip joint and protect the cartilage underneath it. As well, we can treat certain conditions such as tears in the uh, abductor or external rotator region, which is the rotator cuff basically of the hip. I try to maximize conservative treatment as much as possible, and I will tell a patient if I generally think that they'll respond to conservative treatment. A majority of patients can respond to conservative treatment, and that is physical therapy, sometimes intra-articular or inside the joint hip injection of cortisone or steroid. If a patient is able to modify their activity and has a hip joint problem and does not want surgery, then I think that is a valid form of treatment as well. Once those don't work, I think patients can expect to have a relatively quick result from surgery, as it is in arthroscopic surgery with small incisions and not a lot of dissection that needs to happen with that. So an arthroscopic hip surgery is performed generally with 2 or 3 small poke hole incisions around the hip. They're about 2.5 centimeters long or so. And those are mainly on the outside of the hip joint, and they heal very well. So everything that we do is introduced from the outside in, and these small incisions allow us to put a small camera inside the hip joint. Once we get access to that, we're able to bring all our instruments in from the outside. Such as a shaver device or suction device or different types of devices that we use to fix things inside the hip joint. So patients needing arthroscopic hip surgery, there's really no age cutoff for medical requirements. What really we need is to look at the status of the hip joint. So if a patient has a lot of arthritis in the hip, that usually will not respond well to arthroscopic hip surgery. That's why we'll always get an MRI scan beforehand to kind of evaluate that. Also, if patients are, like I said, there's really no age requirement, but it depends on the status of the hip joint cartilage and what the patient's overall function is. After an arthroscopic hip procedure, depending on what it is, patients generally undergo a period of time where they're not putting a lot of weight on the leg, and we call that basically toe touch weight bearing, so they're on crutches and a hip brace as well. And that's anywhere from a period of 2 to 6 weeks after arthroscopic hip surgery. And as well, in this time frame, we also have patients in physical therapy, which is very, very important, which can sometimes be several months after our arthroscopic hip surgery.